I've been a patient of Dr. Michelle since I believe it was July of 2007. I had developed a hydrocele, which he took care of in an outpatient situation, so he became my urologist. This past June, I developed a bladder infection, and in the process of trying to figure out what was wrong and what caused the bladder infection, he did a CT of my kidney and discovered that there was a 2 centimeter mass that we believed to be about 75 to 80% malignant. So it was type of situation of, hey, we got good news and bad news. The bad news is we have no idea what's causing your bladder infection. The good news is go out and celebrate you have cancer. But don't worry, we can take it out. It will involve no chemotherapy, it'll involve no radiation, and that's basically all I heard. I'm sure he went on to explain a lot of things, but it was the type of thing that I said, hey, they're going to get it out. No chemo, no radiation, I'm okay. And because of the hydrocele, I knew I could trust Dr. Michelle. He does good work. I had proof of that. And even when he came back and he says, yeah, it definitely looks malignant. We're going to have to operate, but you got a good surgeon. My internist, everybody said, oh, who's handling this? Michelle. Oh, he's the best that Cedars has to offer. Surgery went great, as smooth as can be. Started at 1:15. By 5 o'clock, I was in recovery and wide awake. And I remember my mother-in-law coming into the room and seeing him in recovery. And you know, she had lost her husband 2 years before to bladder cancer, and so she was reliving everything that I was going through with the kidney, and of course comparing it to my father-in-law's experience. Within 2 days, I was out of the hospital, recuperating. I took 3 weeks off of work, but within 10 days of the surgery, I was on my computer doing email, you know, at least taking it easy. I can't say enough about the wonderful people here at Comprehensive Urology. I've had a chance to meet all of the doctors, Dr. Michelle, Dr. Desai, Dr. DeConcini, who assisted on my surgery, Dr. Sanford, seeing him around the office, and everybody has been great, from the front office staff to the practitioners, you know, the PAs as we call them. They've always been terrific, and I can't think of a better, I'm in such good hands, and that's, I think, the most important part with medical situations. You have to have complete faith in your doctors, and I certainly do in mine. And it started out strictly as a urologist. I never realized that Dr. Michelle was an oncologist too. I'm glad he is, because he wouldn't have found my situation, and it wouldn't have come out for the benefit that it did.